Hi, this is Steve Adubato. We are coming to you remotely. As you can obviously tell, it's the 17th of November as we're taping this, and we're joined by our good friend, John Sarno, president of the Employers Association of New Jersey. Looking good, John. How you doing?
I'm doing well. Good to be with you, Steve.
So I said we're taping on the 17th. This will be seen after that. What do we have to be thankful for in these very challenging times?
Well, right now, at least from what my perspective is that we can be thankful that there's a lot of trust in the workplace. Not in every workplace, but in the majority of workplaces. I think we can be thankful that employers and employees are working together, by and large, on the same page. It's good to see. I mean, I hate to say that it took a crisis to get people on the same page and to get people's attention, but I think we can be thankful for that.
So, John, let me try this. Because this will be seen later, there are certain things that obviously things are changing by the minute with COVID-19, but there are certain best practices, or at least better practices. What are the better/best practices that employers really should be, must be implementing in the workplace to protect not just their company, but way more importantly, their people?
Yeah. So another thing to be thankful for in New Jersey is we have some great leadership. So
you mean in government?
We have an executive order.
In government with Governor Murphy?
I think the Murphy administration is doing a great job. I think his cabinet is doing a great job, particularly the New Jersey Department of Health. I have a tremendous amount of confidence in their work. I meet regularly with them. I get briefings so that I can then translate it to the EA&J members. So now I have a tremendous amount of confidence in their work, particularly the Department of Health. In any event, we start with the governor's executive order in terms of best practices, right? And then we go back to establishing that trust with the employee. So an example might be that an employee's spouse tests positive, right? We need that employee to disclose that to the employer so that the employer can engage in those best practices. It's not going to happen unless there's a two-way street. So then what happens? Well, the employee might have to self-isolate for 2 weeks. The employer may request a negative test before they return. Employees who were in close contact with employees, so that's the CDC guidance, they have to be notified, keeping in mind the integrity and the respect of the privacy of the employee who may have self-isolated. And then there's the obvious ongoing protocols of mask wearing, socially distancing, disinfecting, split shifts, allowing people to work from home who can work from home. And then finally, there's the Americans with Disabilities Act. We have to be conscious that there may be employees, because of a medical condition, may not be able to wear a mask, so we might have to reasonably accommodate that. So that's kind of an overview of best practices right now.
John, I often think about this. As I said, we're taping toward the end of 2020, and since the 13th of March, all of our team, our terrific producers, behind the scenes, our great production team, other than Scarlett, who is our camera operator physically here with me, everyone else is remote. And I'm not sure of this, but I'm hopeful, prayerful that we can continue to do what we're doing as we're doing it. We don't know when we're going to get back in the studio at NJTV or WNET. But that being said, not everyone can work this way. What about those organizations? What about those companies? What about those employers who really need their people in a physical space?
Well, only 25% of
here's where I'm trying to get at, John. I'm sorry. Do you find any employers that are putting pressure on people to physically be in a workplace, many of whom don't want to be there?
Sure. I mean, listen, we've been with our members, you know, from the beginning, through the entire pandemic. And as you said, we're gonna go into this next year. So, you know, we have a continuum of situations, and which includes some employees who are reluctant to come in. So listen, working from home is a privilege, all right? Only 25% of us, only 25% of us can do that. 75% of the workers in New Jersey either are in close contact with customers and coworkers, or in somewhat close contact, right? And then you have the essential employers and employees, healthcare workers, social service workers, food service workers. So sure, there's a lot of guidance on this. There's a lot of workplace safety, health protocols. The bottom line is that no employee should choose between her health and safety in her job, all right?
And no employer should push that issue if that's what the employee believes.
Well, it's objective, right? I mean, so a lot of employees, they may live with older parents, for example, right? And they may be reluctant to go to work, but they may be reluctant to even go food shopping. So, I mean, in those situations, unless there's some concrete reason why the employee doesn't want to come in, then they might have to choose between their job and staying home. So the employee that resists or does not want to go to work really needs some concrete reason, not just a subjective apprehension.
A couple things. John has touched on so many things. And by the way, the Employers Association of New Jersey, one of the many supporters of what we do, particularly on our public policy programming. Check out their website when you see it up there. But I want to make this clear. This is very tough for employees, but also employers. I want to be really clear. The other thing is, John made a great point. I feel blessed. I feel fortunate. I know our team does as well, to be able to work remotely for the most part. But remember what John said, 75% again, John, 75% cannot do this.
Correct. I mean, listen, you know, we have a service economy, right? So, you know, that's physical. Yes. You know, robots, you know, don't do that. And then you have essential production, manufacturing.
And someone's delivering food to the home. Someone delivers food to our home. Someone delivers that package to your home. Someone's out. These people are out there working, and they have to be protected. But the last question before I let you go, John, how tough is it for your members right now, financially, to stay afloat?
Well, the loans from the federal government has helped. I have to tell you that EANJ members tend to be larger, right? Because they're employers, and they are operating, and they're not the kind of small businesses that are really, you know, suffering on Main Street. So I think, thankfully, most of our mid-sized businesses, larger businesses, are operating. May not 100%, but they're more than floating right now. They're I can't say that they're doing well. We're still in a recession, but it's not dire.
You know, as we end this segment, just remind folks, as I said, right before Thanksgiving, we're taping. It'll be seen after. The vaccine, everyone hopes and prays. However, there are a lot of things we must, it sounds redundant, John, but we still have to keep wearing masks, socially distant, washing our hands. Yeah, redundant, but for some need to be reminded on a regular basis, all of us. Final words, go ahead, John, 20 seconds.
Well, vaccine's going to be rolled out over multiple months, well into next year. So,
that's right.
You know, the state's goal is ambitious, 70%. Now, if we're not getting to 70%, we're going to be wearing masks, socially distancing, the whole works for a very long time. So, you know, the next big step then is vaccinations.
John Sarno, President of the Employers Association of New Jersey. Thank you, John, my friend. Best to you and your family and your members. All the best.
Best to you and your staff and to your family. Thanks very much.
Thank you. I'm Steve Adubato, and we will be right back.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation. Funding has been provided by TD Bank, Horizon Blue Cross Blue Shield of New Jersey, the Northward Center, the Robert Wood Johnson Foundation, the Healthcare Foundation of New Jersey, ADP, the Fidelco Group, PSC&G, and by Rutgers University, Newark. Promotional support provided by NJ On Air and by ROINJ.
The Northward Center was founded on the vision that community is connected to neighborhood stabilization, and neighborhoods need a place for kids to play. That's why we're building a recreational complex in the heart of Newark. Unfortunately, inner-city youth development programs are dwindling. We want to expand on our promise and build a place where kids are welcomed and doors remain open. The Northward Center, building a better community, 48 years and counting.